Hi, my name is Jennifer Bleacher.
My name is Zach Swanborn.
Hi, my name is Lauren Black.
I have cystic fibrosis. I'll be 50 years old this year, and I live in Coatesville, Pennsylvania.
I'm 21 years old. I'm from the greater Los Angeles area. I was diagnosed when I was about a week old.
I am 18 years old from Royersford, Pennsylvania, and I was diagnosed with cystic fibrosis at 2 weeks old.
I have two rare CF mutations. The first one is 621 plus 1G arrow T. And the second one is 3659 del C.
My CF mutations are Delta F508 and W1282X.
My mutations are 2 copies of Delta F508.
Because I was so mild, we really didn't have to focus a lot on my CF. Like, I was able to pretty much have a typical childhood with all my friends, except I saw the doctor and took pills when I ate and stuff. Sending her off to kindergarten for her very first day in our home video, I was hooked up to an IV. I just tried to make how my mom did for me. Like, life can just go on. It's just I might have to do a couple other things over here on the side.
For me, a normal day with CF actually isn't super different from that of a normal person. I spend generally 40 minutes a day doing breathing treatments, usually 20 minutes twice a day. For me, my primary CF impacts actually changed throughout my life. When I was born, I had this thing called meconium ileus, which is an intestinal blockage that a lot of CF babies have, and it required emergency surgery. So my doctors have kind of known since I was born that I was probably going to be a GI case.
Growing up, CF was always a huge part of my life. It was never in the background of my life. It was always front and center, and it was just something that was normal to me. Having hospital stays, going to doctor's appointments was all part of my life, and I didn't really think anything of it. I kind of thought that's how everyone was. But as I grew up, I realized that being hospitalized over 15 times wasn't necessarily the norm, and I had to do things that other kids didn't have to do, which was hard.
I didn't have a bowel movement in my first 24 hours of life, which you can't get a discharge from the hospital for, which is how they found the blockage. And luckily, back then in 1971, the doctor that was at Bryn Mawr Hospital knew that a blockage in that spot was a red flag for CF.
It really has been a battle my whole life to gain weight. As far as my lungs go, when I was a kid, I was good. I did my treatments twice a day, and that kept me healthy. My lung function was always in the 90s, never really went below that until I turned 16. When I turned 16 and then 17, it got really bad. I started to have a more rapid decline where those treatments weren't working for me anymore the way they used to. My lung function went down from the 90s into the 60s, and that only took a year or so to happen.
The mutations aren't necessarily one size fits all, and that's a big misconception, I feel like, in the CF community, that, oh, you have this mutation, well, you must be X amount of sick, or you take this amount of medications. But each person is different, and CF affects everyone differently. Someone could grow up never being in the hospital and really lived a normal life, while other people grew up, like myself, in and out of the hospital, and that was their norm. It's all about who you are, and it's important to ask each person what their own personal story is, and not just assume things.
I've had like odd sugar levels for years and years and years, and my older CF doctor, we were treating it with like a pill for like typical diabetes, and I was having a lot of issues. It really wasn't working well. But now that I'm with a different care team, they send you to an endocrinologist who's taking care of all the CF patients for their CFRD. And CF-related diabetes is different than type 1 or type 2. And there's actually, it's not really a well-known, it's kind of a new diagnosis really out there in the world, in the diabetes world. So there's not a lot of caregivers that are, or physicians that are up to date with everything about it.
I do have onset CF-related diabetes, which is kind of the same symptoms as type 2 diabetes and is the closest comparison to CF-related diabetes, except the major difference is that it can't be controlled with a diet or with exercise. There's nothing you can really do to prevent CFRD, and is most commonly diagnosed or you get symptoms in your teens.
My CF issues have changed throughout my life, and that I was pretty much only digestive when I was a kid. My lungs started to get really bad as a teenager, and now, with more medical advancements, my lungs have gotten a bit better. They're up back into the 80s, and that's kind of where they're at right now. But my GI situation, aside from being able to gain weight, I did gain 20 pounds, but my other GI situation has not really improved.
For my first 20 years of life, really, I did not cough. I never needed a neb. I was never hospitalized, nothing respiratory at all. It was all GI. I had belly pains all the time. I was put on enzymes as a baby, so I was taking enzymes all the time, but it was really just belly pains.
For me, cystic fibrosis affects my lungs, pancreas, liver, digestive system, and kidneys. Especially with my pancreas, my body can't let out enough enzymes for the amount of fat that I'm intaking when I eat. That's due to the thick, sticky mucus that clogs all of my major organs. So what I have to do is I have to take 5 pills each time that I eat something with fat in order to digest it, which leads to a lot of weight trouble for me personally. I have a really hard time gaining weight, and it's really easy to lose weight as well with CF because just sitting here I'm burning 10 times more calories than the average person because my body is working 10 times harder to just survive. Because of that, I also have a feeding tube in my stomach that I got placed when I was 3.5 years old.
When I was younger, I didn't want much to do with the CF community just because I was so caught up in the complications from my own disease, that having to compare myself to others who were either doing better or doing worse for me was not something that I was interested in, and rather just kind of focus on myself. But as I got older, I realized that it was really isolating, and I actually didn't know a lot of others who had CF, and maybe learning more about their different experiences, but also kind of reaffirming my own, and hearing others who've experienced the trials and tribulations of CF that I've had, and the same issues and all that stuff. So I think it's been great to connect me to other people with CF, but I can understand them.
I was on the transplant waiting list for almost 2 years. When you sign up to get a transplant, you do have to get a caregiver to commit to be your primary caregiver. And they're basically committing to being with you for 3 months straight.
I'm fortunate enough to have a great support system in my life, and a huge part of that is my team, Lawrence Lifesavers, that participates in the Great Strides Walk every year. We have raised tons of money for the Cystic Fibrosis Foundation, which is all nonprofit, and it's really great to have that support system. So when I am admitted or I'm going through a hard time, I know that I have people in my corner and cheering me on. I can't express my gratitude enough towards all the people that support me and have always been there for me, whether it be sending me a text, wishing me well while I'm at a doctor's appointment, or visiting me in the hospital. CF is a progressive disease for which there is no cure for, but a newer drug that's come out is Trikafta, and it's been really great for the CF community, and a lot of people, including myself, have been doing so much better on it, and it's lessened hospital stays, lessened medications taken, and all types of great stuff. My goal for this documentary is that I can educate more people on CF, as it is a very rare disease and not a lot of people know about it. Especially with it being an invisible illness, you wouldn't know if someone has CF just by looking at them. I will always keep advocating for myself and continuing to raise awareness until CF stands for Cure Found.